I'm a hip and knee specialist, so I am a specialist for hip and knee replacement. We perform generally for major joint surgery, hip or knee replacement, total hip replacement, total knee replacement, and partial knee replacement generally. Best part about my job is being a surgeon, to help to our patients and to be involved in the patient's care, and then to give one of our best here in England. So we are one of the, I think, regarding the hip and knee replacements, this hospital one of the best. According to the National Joint Registry, there are, as far as I know, only 7 hospitals who are better than expected category regarding the hip and replacement revision surgery. So and we are one of them. So we are very proud of this. I treat, I think, 10 or 15 private patients personally, but the whole team, I think, perform more than this. So it is, I think, 50 or something like that. Sometimes we have a referral from the GP, but sometimes the patient refers themselves, and in this way we can start a conversation, and we can treat the patient as soon as possible. If the patient has a private medical insurance, the patient can walk into this office almost immediately, as soon as possible, and we examine the patient. We can X-ray the patient. For example, if the patient has a knee arthritis and pain, let's say over a year, and underwent non-surgical treatment already, and if the X-rays and the clinical findings suggest that the patient requires a knee replacement, we explain the benefits and the risk to the patient, and even on the same day the patient can consent for this surgery, and after then we can have a full preoperative assessment. The nurse staff and the anesthetic staff can examine the patient within a couple of days. We can check the blood tests out. All of the requested lab can be done, including ECG, chest X-ray, etc. And within 6 weeks, we can perform the surgery. If the patient has a private medical insurance, the patient can choose this hospital, even can choose a specific surgeon as well. So if I examine the patient, I meet the patient, and the patient is happy with me, the patient can book on my specific list, and within 6 weeks the patient can undergo this surgery. The initial consultation is very important, one of the most important part of the pathway, because we definitely should explain all of the details of the surgery, including the benefits, the complications, and all of the question of the patient should be answered in the proper way. So when the patient get up and say goodbye, the patient shouldn't have further questions. Of course, if the patient will have any other questions, they will have opportunities to call us, or even we can make another appointment, and we will be able to answer their questions again. Normally, the scheduling time is within 6 weeks. Sometimes it is sooner, but sometimes very occasionally a little bit later, depending on for example, the anesthetic appointment or anesthetic assessment. If the patient requires further investigation, for example, cardiac surgeon or cardiologist investigation, maybe this will postpone the scheduling. But normally, most of the case, we can perform the surgery within 6 weeks after the initial consultation. if you have any problem or symptoms or pain over on your joints, or if you think that you need definitely an opinion, an expert opinion, you can come to our hospital and we can give you an expert advice. Of course, if you won't require a surgery, we will tell you, or if you need a further investigation, definitely we will tell you, and we will address to your GP, and even we can request an MRI or X-ray or further investigation. So please come here, okay, and we will try to treat you as much as we can.